In this video, we will discuss peritoneal dialysis. We'll take a look at the order in Epic and the supplies that we'll need in order to complete this procedure. Before we begin to gather our supplies, we'll need to look at our order in Epic. All orders for peritoneal dialysis must be entered by a nephrologist. If it's entered by any other physician or nurse, it is not a valid order. If you weren't already aware that your patient required peritoneal dialysis, the first place you may realize this treatment is needed is when you open your MAR. Look under your scheduled meds. You'll see there's an item for intraperitoneal dialysate. This is the solution that you're going to use for your peritoneal dialysis. Here we can also see the type of solution that is ordered. Traditionally at St. Mary's we use a 2.5 or a 1.5% solution, but there's also the possibility the patient may have some specialty solutions ordered and brought in from outside. The volume of the bag can also be found here. This is a 2,000 milliliter transfer. Now look at the total number of transfers per day. Transfer is the term used to describe the act of removing old fluid from the peritoneal space and replacing it with fresh dialysate. This order specifies that this patient requires 4 transfers per day. The MAR shows us that the next transfer is scheduled for 1300. However, the timing of the transfers isn't really the important part. You don't need to follow the schedule that the MAR sets. You just need to make sure the patient receives the appropriate number of transfers every day. The MAR is going to space those transfers out evenly over a 24-hour period, but you don't need to wake people up in the middle of the night to perform peritoneal dialysis. This is supposed to be a convenient thing for them to be able to do at home, and waking up in the middle of the night isn't exactly convenient for someone. So, space them out evenly over the course of their waking hours. This schedule can be flexed around meals, other therapies, or tests throughout the day. The majority of the work done from a transfer is completed in the first 30 minutes of that fluid dwelling in the peritoneal space. So as long as you have at least 30 minutes of dwell time, you're able to do the next transfer. There are a few things we need to do to get set up before we can actually begin our transfer. There are 2 companies that do peritoneal dialysis. You'll need to determine if your patient uses Baxter or Fresenius. At St. Mary's, we only support the Baxter system, so if they have a Fresenius catheter, you'll need to replace it with the Baxter piece. On every unit, you can find a peritoneal dialysis folder. This will give you information on what supplies you'll need and how to complete the transfer. You'll be gathering supplies from a few different areas. We'll need 2 items from Central Supply. Go to ServiceNow Self-Service on your ZenWorks page. Now you can either click Request Something, or up at the top of the screen, you can choose Service Catalog. In the upper right corner, CSPD Materials Request. The first thing we need are mini caps. The keyword for our search engine is caps. On our CSPD form, ensure that your location information is correct. Then choose for the category Tubes, Drains, Bags, and Accessory Charges. In the search field, type the word CAP. When you select the item, it will fill the information into your orders section. You need to include the number of that item that you want delivered to the floor. For the caps, we tend to order a lot of them because you're going to use them every single time you do a transfer. So order at least 10 when you're ordering them initially. Our next items will be Ultra Clamps. The keyword for searching will be clamp. In the search bar, type clamp and choose the Ultra Clamp item. This will autofill the information to your order section, and you need to include that you will need 2 Ultra Clamps for this patient. These same 2 clamps will be used for every one of this patient's transfers during their stay. There are a number of items you'll need to gather from your unit. You'll need clean gloves, blue procedure pads, 4x4s, scissors, a mask for everyone that's going to be in the room. From the peritoneal dialysis folder, remove a door sign that says please do not enter. And finally, an IV pole. The last supplies we'll need will come from pharmacy. The dialysis solution, also known as dialysate, will be delivered from the pharmacy. With these supplies in hand, you're now ready to begin the first stage of your transfer.